With me today, I have Dr. William Moskowitz. He is a pediatric cardiologist, and I also have Dr. Datta, who is a head of pediatrics at our very own Milton Cato Memorial Hospital. Dr. Moskowitz has been working with the World Pediatric Project for 15 years now, and he is absolutely passionate about what he does. Therefore, he derives a lot of pleasure from donating his time and his expertise to the yearly cardiology mission of the World Pediatric Project. Dr. Datta also is very passionate about pediatrics, and since she has been the head of pediatrics here at the Milton Cato Memorial Hospital, we have seen a lot of changes. Some of these changes have come about especially with the collaboration with the World Pediatric Project. Dr. Moskowitz, we understand that when you come, you don't only attend to patients, you also do training.
As always, we are very organized. Sister Jackie King, Dr. Datta, always have everything under control so that when we start in the morning, everybody's lined up, the patients are ready to be seen, we have all the documentation. Children were here with congenital heart defects as well as with rheumatic fever, rheumatic heart disease. Some were new patients, some were patients that we've been following here for years. So it's always good coming back and following up our patients and the families who trust us, who we've grown to know over the years, as well as the new patients, and educate medical students in the process of knowing how to do examinations, how to recognize diseases, and the echocardiograms, chest x-rays, and other laboratory studies.
Okay, we saw you doing training with some skilled persons already that need to understand the operation of the echocardiogram. Tell us something a bit about that.
So the echocardiogram is a remarkable tool. We can actually see the heart beating and looking at the anatomy as well as the function of the heart. So again, as I explained to everybody in attendance today, you have to use your clinical skills and your stethoscope first to know what's going on with the patient, and then to take the pictures, and really supports your clinical diagnosis. So it can give you information about the anatomy of the heart, the function of the heart, and what the disease process is, if it's gotten better, if it's gotten worse, as well as to diagnose congenital disease and know when the right time is to operate on it. So it would be very helpful, as an example, when we see a patient who clinically may have rheumatic fever, and I come here once a year. So 364 days after seeing that patient here is when I will see them again. So if a patient comes in with a fever and joint complaints and may have a heart murmur, the question is it rheumatic fever? Or is it just a cold and a virus and they have an innocent heart murmur? If they can do an echocardiogram at that time and show the valves are normal and the heart is normal, then it's not rheumatic fever, as opposed to then the child being on medications for a year until we see them. So it really raises the quality of the diagnostic care and the therapies.
You're giving two terms. You are talking about cardiology dealing with the heart, and then you're talking about rheumatic fever. I think the average layman does not understand what's the connection.
True.
What, therefore, would you say the connection is?
So, Cardiology 101. Congenital heart disease is something you were born with. On the planet, the same prevalence, whether it's in St. Vincent, in Grenada, in China, in the US, it's about 8 to 10 per thousand live births. So about 1 in 100. The prevalence here is no different. And that's a congenital problem. Sometimes it's genetic, sometimes it just happens with a certain frequency in the population. Rheumatic heart disease or rheumatic fever is acquired. It is acquired sometimes between the age of 5 and 15 years, most commonly, due to the fact that somebody had a strep throat, which was not treated. And Panadol, a simple shot. So if somebody is seen with a fever and a sore throat at age 5, 10, 15, and they go to the health district nurse, they either can culture for strep or do a rapid strep test, or say, gee, those tonsils look really ugly, and give them a shot of Panadol, you have prevented rheumatic fever. If you miss that opportunity 2 to 3 weeks later, because that strep is very similar to the heart tissue, your body starts fighting that. and the body then starts attacking your own tissues. And that's how you get the valve damage. So by treating the strep early, you prevent rheumatic fever. So it's an education of the families, the schools, the health districts, and the doctors that if a child in those age ranges has a fever and a sore throat, they should get penicillin.
Okay, so now we understand. Dr. Datta, you have been an integral part in the organization of these clinics, and if someone visits the clinic on any given clinic day, they would see you as a major player there. You make sure you have the medical students coming in, you make sure everyone is on board for the proper running of the clinic. Give us a little idea as to what you really do.
I see patients throughout the year. That's what I do.
Okay.
Throughout the year, I'm seeing the really sick patients, the babies who are born with murmurs, babies who may develop murmurs as they grow, especially the rheumatic fevers. So this is my work throughout the year, which culminates every year during the cardiology mission.
Okay.
This is just only pertaining to the children with heart disease. And cardiology by far is my favorite subject.
Okay.
So that's how it is.
Okay, and being a doctor of such long experience, generally speaking, you were attending the training today. How come you found it necessary to be at such a training?
And doctor's life, I think the day you say you know it all, and I think that's the day you should start thinking of quitting. And I know I'm being very harsh on myself and the others, but it is a fact. You don't know it all. You do not know it all. And one of the things that I learned when I joined the WPP bandwagon, and I said to myself, I thought I knew. I had been a consultant for years with a lot of experience. And when I joined the list of specialties, I was instrumental as part of the screening process. And one of the earliest lessons I learned was how much I didn't know. That's where it started. I didn't know a lot of things, and it has been a learning session. I don't think anybody should move away from that. The day you think you know it all, just move. Okay, just leave.
Thank you, doctors. Now, from what we have heard, it is therefore safe to say that not only does the WPP stretch its arms out to young patients here in St. Vincent and the Grenadines and throughout the Eastern Caribbean, but also the specialists themselves, there is something to gain, something to benefit, where one teaches the other and then therefore upping the service that is offered here at the Milton Caton Memorial Hospital, all through the efforts of the World Pediatric Project.